Hello, welcome to Healthy Nation. I'm Pat Murphy. Often, someone who has suffered a stroke or a brain attack may experience a change in memory or speech, or even paralysis on one side of the body, making stroke the nation's number 3 cause of death. But did you know that as much as 80% of strokes are preventable? And what you do immediately after a stroke is critical to minimizing the long-term effects. Here's Dr. Paul Knopfelmacher to tell you what's going on in your body to cause a stroke and explain the symptoms that you should watch for.
A stroke occurs when normal blood flow to the brain is interrupted. There are 2 types. The first type are what we call ischemic strokes. This means that not enough blood is getting to the brain because blood clots or plaques form inside the blood vessels. Blood carries oxygen and nutrients to different parts of your body. When blood flow to your brain is blocked, your brain cells begin to die within a matter of minutes. Ischemic strokes make up about 80% of strokes. The second type of stroke is called a hemorrhagic stroke or cerebral hemorrhage. This happens when a blood vessel ruptures and blood spills into the brain, killing brain cells. It is usually caused by high blood pressure or an aneurysm. An aneurysm is a weakened area of the blood vessel that balloons out and can rupture. Although it is less common, hemorrhagic strokes can have devastating effects. When brain cells die during a stroke, some of the basic functions controlled by the brain are affected. These include movement, for instance paralysis, weakness, or numbness in parts of the body, speech and communication, memory, vision loss, and even personality may be affected too. In some cases, a person may experience a transient ischemic attack, or TIA, also known as a mini-stroke. In this case, lack of blood flow is temporary, resulting in stroke symptoms that last only a short time. TIAs are warning signs that a major stroke is likely and should be taken just as seriously. In fact, 1/3 of people who have a mini-stroke will go on to have a stroke, so you shouldn't ignore it. A stroke can happen suddenly. So how do you know if someone's having a stroke? I'm going to walk you through a list of signs. You may want to pause or rewind to write these down. A sudden numbness or weakness in one side of the body, specifically in the face, arm, or leg. Severe headaches with no known cause. Dizziness and a loss of balance or coordination. Sudden confusion, trouble speaking or understanding. Trouble seeing in one or both eyes. If you think someone may be having a stroke, the National Stroke Association recommends acting fast by performing the following tests to assess the person's condition. Ask the person to smile. Does one side of the face droop? Ask the person to raise both arms. Does one arm drift downward? Ask the person to repeat a simple sentence. Are the words slurred? If the answer to any of these questions is yes, then time is critical. You should call 911 or take the person to the hospital immediately.
The impact of a stroke may depend on how quickly you respond and get treatment, so always pay attention to these signs, and if you have any doubts, get medical attention immediately. Having a stroke can be a scary experience, but you should know that you can take steps to prevent it. Here's Dr. Paul Knopfelmacher with more on the prevention and treatment of strokes.
When it comes to preventing a stroke, there are 2 types of risk factors, those that you can control and those that you can't. First, let's talk about the risk factors that can't be changed. Your age. You're at higher risk if you're over 55. Gender. Men have a higher risk. Ethnicity. African American, Hispanic, Pacific Islander, Asian, and South Asians are at risk. Family history of stroke. You've had a TIA or stroke in the past. Risk factors you can control are directly related to your lifestyle and to other medical conditions. I'm going to walk you through some things that you can do to prevent strokes. You may want to pause to write these down. Have your blood pressure checked every year, because high blood pressure or hypertension is a major risk factor for stroke. And many people don't even know that they have high blood pressure. If you do have high blood pressure, your doctor may prescribe medication, as well as recommend a change in your diet and exercise. It's also helpful to manage stress. Find out if you have diabetes. Diabetes accelerates blockages of your arteries and increases your risk of stroke, so it's important to keep it under control. Stop smoking and limit your alcohol intake. Lower your cholesterol. High cholesterol can clog your arteries and keep blood from moving to the brain. And finally, maintain a healthy weight. Being overweight increases your stroke risk, so finding an effective exercise and diet plan is essential. Also, if you're taking birth control pills, it's important to talk to your doctor about your risk of stroke, especially if you're over 35, you smoke, and if you have high blood pressure, diabetes, or high cholesterol. Hormone therapy for menopause may also lead to a slightly increased risk of stroke, so talk to your doctor if you're taking hormone replacement or if you're thinking of doing so. There are several different ways to treat a stroke. First, medication. If a stroke is caused by blood clots, your doctor will likely administer clot-busting drugs. These drugs must be given within 3 hours of the start of the stroke in order to be effective. So again, it's critical to act fast and to get to the hospital if you think a stroke is occurring. To prevent a second stroke from happening, anticoagulants and antiplatelet agents like aspirin may also be prescribed to help prevent further blood clots. Sometimes your doctor will recommend a surgical procedure to clear blocked arteries to the brain. Carotid endarterectomy and angioplasty or stent placement are 3 possible procedures. Aneurysm clipping can prevent an aneurysm from reopening and rebleeding into the brain. Talk to your doctor if you have questions about these procedures and whether they might be right for you. Finally, rehabilitation. After a stroke, many of your body's functions may be affected, so relearning things like walking and talking may be part of the recovery process. Physical therapy can help with movement, balance, and coordination. Occupational therapy may be recommended for relearning skills like dressing and bathing, and speech therapy may be used for relearning how to talk. Your doctor may also recommend seeing other professionals like a dietitian, a social worker, or psychologist to make the rehabilitation process as successful as possible.
Stroke is the 3rd leading cause of death in the United States, but you can take steps to prevent and treat it. Thank you for being a part of Healthy Nation. Check back soon to learn even more about your health.